Hello everyone, I'm Richard Conway reporting for Room Now from ACR 2024. I'm going to talk to you today about a study presented at Sunday's plenary session. This was from Cornelia Kwak and colleagues from the Netherlands. It was abstract number 1647. So this was a study looking at rheumatoid arthritis and looking at treat to target, and was particularly interested in the pregnancy space. So to do this, they had a new study, which was called Pre-CARA, and they were comparing this to their previous study of these patients around pregnancy, which is called PARA. There were 215 patients in the new study, 245 in the old study. And the difference between them was that the old study was kind of a standard of care study, and the new one was this treat to target implementation in this group who were intending on becoming pregnant. So to do that, they had this escalating regime of drugs, starting with sulfasalazine and hydroxychloroquine, and if necessary, adding in a TNF inhibitor. And they also, based on previous knowledge of how medications affect pregnancy, had a real focus on trying to limit non-steroidal anti-inflammatories and glucocorticoids in these patients. So the first thing, did the treat to target achieve what it set out to do? Did it reduce disease activity? And it did. So DAS-CRP was 2.33 in the new study compared to 3.84 in the old study. And then looking at fertility. So they did this by looking at the time to pregnancy. And that was 84 days in pre-CARA in the new study compared to the historical 196 days. And then when they looked at kind of problems conceiving or bigger problems conceiving, so looking at a 12-month cutoff, who got beyond 12 months, it was 23% of patients in the new group compared to 42% of patients in the older cohort. So this study, I think, really very much says that fully controlling disease activity and using the agents we need to do that improves fertility. And so now we know that it improves fertility. We already have other data showing that it improves pregnancy outcomes, reduces stillbirths, preterm births, miscarriages, all those sorts of things we really want to avoid. I think this increasing evidence that we need to be better and need to be optimize the treatment of patients who are planning pregnancy and becoming pregnant. We need to overcome the fears that many patients have regarding these medications through education and spending the necessary time with them. And I think we definitely also need to overcome a bit of an inertia among both physicians and patients regarding these agents and not putting things off until after pregnancy, that everything will be better. And we can confidently say that based on the data that we now have if we treat these patients with certain of the medications we have available to us. So I'm Richard Conway. You can see me on Twitter at Richard PA Conway, and do check out Room Now for all the up-to-date coverage from ACR 2024.